Welcome to Living Healthy Chicago. I'm Jane Manzuris. Now, sometimes the biggest frustrations that come from a health challenge are the impact they have on small moments of everyday life. That's why it's important to seek help when you're struggling and not just deal with it when something seems off. This next woman says she's grateful she got help for her carpal tunnel syndrome for that very reason. It was many years ago that Mary Beth Lenz started noticing a problem with her hands.
I no longer could hold on to a phone in my hand. My hand would go numb and I was constantly switching hands. Drinking a cup of coffee, if you held that cup too long, your hand would go numb and you'd feel you have to put it down.
Those issues eventually began to impact her routine more and more.
Well, it started to progressively interfere with what was going on. I could no longer manage it. Couldn't sleep on my side. I was constantly waking up because my arms would go numb. When you can't sleep, you get crabby. Eventually, I had some pain discomfort in one of my arms and finally said, enough's enough.
Mary Beth went to the doctor who ran some tests and diagnosed her with carpal tunnel syndrome.
There are a couple things we can do to make it. Carpal tunnel syndrome is a very common malady of the hand. It's essentially a compression of the median nerve as it innervates your hand and wrist. There are many factors that could go into compression. For some people, work-related. It could be systemic. It could be a abnormal muscle within your wrist for some reason. People would complain of numbness, complain that the numbness is so severe that it wakes them up at night. For some people, they have to shake out their hand. For some people, it could also cause pain.
You get frustrated. It became part of my life, knowing that I couldn't do certain tasks. I started dropping things. You're limited.
She came to me with bilateral carpal tunnel syndrome. Unfortunately, that test showed that it was severe. To correct it is surgical. So the idea of carpal tunnel surgery is that you're trying to relieve the pressure on the nerve.
So finally I just said, I have to go in and get it done.
Mary Beth had surgery first on one side and then the other, and it didn't take long for her to notice a change.
Within 24 hours, I could tell the difference. The numbness and the tingling and the I can't feel my hand anymore, that's gone.
We did her second surgery, I would say 4 to 6 weeks after the first. She did very well, her recovery was very fast. For patients who have severe carpal tunnel, the surgery may eliminate their numbness and night pain almost that night.
The strength is coming back every day. I can hold a conversation, hold my phone for 15 minutes.
Mary Beth says one of the best parts of feeling better is being able to enjoy everyday moments, like playing with her dog.
I can play tug of war with my German Shepherd. Now the limitation is how long can I do it as opposed to I couldn't do it. It's a wonderful feeling. It just gives you the freedom to do what I need to do. To walk the dog, to hold the leash instead of always switching hands.
Mary Beth hopes others struggling with carpal tunnel will hear her story and decide to get help instead of living with frustration.
Talk to your doctor and find out what the best course of action is for you. Getting that information, you can make the best choice for what you need to do.
Carpal tunnel syndrome is a common condition. Management depends on the severity. Carpal tunnel syndrome could be treated without surgery. If it is surgical, it's a very minimally invasive surgery with a quick recovery. If a person starts having numbness in their fingers, if it's persistent and it doesn't get better with time, then you should see your doctor to get evaluated.
Don't be afraid to do something to improve your life and the day-to-day things that you do every day. It's fixable. It's not something that you have to live with. I feel so much better. I'm just glad I did it, and now I can move forward and do more.
Do you want more Living Healthy content? Well, check out these videos right here, and then subscribe for more right here.